Hello. In this episode, I spoke to Professor Mary Louise McLaws, an eminent infectious diseases epidemiologist from the University of New South Wales and an advisor to the World Health Organization. I asked her what a pandemic actually was and how it compared to infectious diseases outbreaks in the past, what exactly a coronavirus is and how transmissible it is. The question I sort of really wanted to ask you first is, what's a coronavirus?
What's a coronavirus? This particular one, SARS-CoV-2, belongs to a very large family of coronaviruses, and there are many human viruses within this family, and we know one quite well called SARS that caused the outbreak in 2003. This particular one, SARS-CoV-2, had its debut on the world stage in Wuhan, and it's believed it came from a wet market. But I'd caution us to not blame Wuhan, because these sort of novel viruses we see all the time in Lassa virus, hantavirus, etc. And it's where humans enter into the realm of the animal and we get too close. Now, we're not sure exactly whether it was because somebody ate a bat, whether they had some of the body fluids of a bat, or whether they were part of the community deep inside that area, which is known for having a lot of bats in that area. But it is a zoonotic disease,
Right.
and
Okay.
it's novel, meaning it's never happened before.
Okay. What's the relationship with coronavirus and other viruses that we may know a little bit more about, like, the cold or influenza?
Okay, so let's compare it to two novel viruses, such as MERS and SARS. Now, for example, MERS was around in about 2015, caused an enormous amount of anxiety. It came from, we believe, camels, but it can come from multiple different types of animals. It then transfers from the camel to humans, and there can be human-to-human transmission of MERS, but it's usually very close contact, and sadly it's usually with healthcare workers, because they have such continuous close contact with a case of MERS. So MERS had a large, very big mortality rate, but the numbers were small compared to, for example, SARS-CoV-2 that we now know called COVID-19. So there are a couple of thousand cases, the majority of them in Saudi Arabia, but also, of course, we know that South Korea had MERS because South Korean had visited Saudi Arabia and took it back and caused nearly 200 cases. But then again, they were very close quarters. Now, if we move to SARS in 2003, so SARS-CoV-1, by default, I guess, that caused great anxiety. That happened in 2003, so before MERS. It was one of the first novel viruses that became a pandemic and caused anxiety around the world. It caused a very high death rate, but it was only about 6,000-7,000 cases. Now, I say only about, and that's a lot of cases. But the difference between COVID-19 and SARS 2003 was that SARS 2003, the patients got very, very sick fairly rapidly, which meant that they had admission to hospital, so they were out of harm's way, away from susceptibles. Mind you, the susceptibles that were in harm's way were healthcare workers. Of course, we had sort of three waves. The epidemiology of SARS was not just singular, wasn't just in China or a little bit in Vietnam or Hong Kong. So Hong Kong had the second largest number, or Canada, where they failed to close their border when they were warned, and they had an outbreak in a church meeting. But really, it had a community outbreak Then it had an outbreak in healthcare workers, and then another interesting outbreak in a very specific area of the Amoy Garden, where it had, we think, mutated a touch so that it expressed itself not just as a respiratory but also in diarrhea. And now we know, of course, COVID-19 in about 17% of cases also express itself as a bit of diarrhea, and you can find it in feces.
Okay, so you mentioned the word pandemic, which of course is on everybody's lips now. And I wanted to ask you, what exactly is a pandemic? Yeah. And also, how does it compare to other potential massive outbreaks of disease like influenzas in the past?
So pandemic has a very specific meaning for both epidemiologists and the World Health Organization. So for epidemiologists, it's usually meaning that it's moved out of the epicenter and into other countries, where it's now become endemic in that country or an epidemic for that country. But for WHO, it means that it has moved into more than 2 continents. Now, they don't like to call a pandemic immediately because it usually refers to countries needing to go into mitigation rather than prevention. So they are usually a little slower to call it a pandemic because they want countries to work very hard when they call it a global emergency, which they did for COVID-19 in January. They called it emergency to get the governments around the world to start working as a whole of society and whole of government approach to buy them some time and get ready to organise health systems, their community to cope with social distancing, so you don't waste time and wait for them to call a pandemic. A pandemic is where they've basically said, okay, we are really in a serious position from a global perspective. But from the individual country perspective, you need to take note when they call it a global emergency.
Okay. And its comparison to things like strains of influenza, Spanish flu, that sort of thing?
Look, it's very interesting. I'm always asked about the comparison with flu. Oh, look, flu kills people and there are more cases of flu. But I was looking at the numbers for, say, the United States for flu, and the numbers of expected deaths this year are somewhere in the United States, somewhere between 29,000 and 59,000. They've already got into that area of magnitude for deaths. And don't forget, they're only into really their epidemic in the last month. Sure, they had a few numbers before in February, but for the last month. So they've already got a very high death rate that will probably surpass their influenza season. And when we look at the global influenza season, they take account of both the North and the Southern Hemisphere. Well, we've only been in this for 3 months in the Northern Hemisphere for China, and we're already seeing an enormous death rate, but there are 30 days often it can take a patient, 30 days to die. So to try to estimate the death rate on the current cases now is incorrect epidemiologically. We need to look at it by a cohort effect of the number that have died or recovered and use the number who have died divided by that cohort, and you'll see that it's at least 6%. But when you're starting to look at correctly by age groups, you'll see it's much greater in the older age groups.